I'm Amy Wright, registered dietitian and certified diabetes educator. And today I wanted to talk to you about diabetes medications. So you picture yourself, you're just leaving your physician's office and you find out your blood sugar is elevated and it's above a hemoglobin A1C of 6.5. That means that your blood sugar is running on average around 140 milligrams per deciliter. And that's a little bit high. So at that point, if you've already tried diet and exercise, your physician will likely put you on diabetes medications. Now, there are two different classes of diabetes medications. Firstly, they're going to be oral medications. And then secondly, there would be injectable type diabetes medications, which are becoming more and more popular. But a first line of treatment would likely be metformin. That's the most common medication. And this medication works by causing the insulin that you already have on board to work a little bit more efficiently. And it does have a few side effects, so that's something that you may want to consider if you have problems with your digestive system at all. Sometimes people can't tolerate metformin, but it is a very inexpensive drug and very effective in lowering blood sugar. So most likely you will be prescribed that medication if you don't have any reason to not prescribe that. Secondly, another type of drug that would be an oral medication would be called an SGLT2 inhibitor. This is a medication that causes the kidneys to excrete more of the extra glucose into your urine. So sometimes people may have kidney disease, they may not be able to take that medication, and it does have a side effect of maybe having yeast infections if people excrete a whole lot of excess glucose through the urine. So with every medication, there's always a side effect, right? But then the final category would be an injectable diabetes medication. And this type of medication has become very, very popular. It's called a GLP-1 receptor agonist. And the most popular one that you may have heard about is called semaglutide. There are different varieties of this medication type. But the way it works is it works in the gut, the liver, and the pancreas to lower blood sugar. And it helps regulate those hormones so you feel fuller more quickly. It decreases the digestive rate, so you're digesting your foods more gradually, which makes you feel fuller, longer. It increases the release of insulin from the pancreas when we eat, and then it decreases the release of glucose from the liver when we eat. So that's how that medication works. They all have pros and cons, and it's really up to you as the patient to do your homework, do the research, find out what would work best for you in whatever situation you're in. Most of these medications do have the benefit of some weight loss, and most people with type 2 diabetes do have that issue, so that can be helpful too. I hope that you found this information helpful. If you'd like more information, just call the Health District and they'll be glad to help you.